Today, we're going to demystify a condition called alopecia areata. We'll walk through what it is, how doctors figure it out, and what the journey can look like for people who have it. So let's dive right in. Okay, let's start with a story that's actually pretty common. Picture a young woman who, out of the blue, finds a perfectly round, smooth patch where her hair is just gone. She doesn't feel sick, it doesn't itch, it's just there. This is often the first moment someone encounters alopecia areata. So you have to wonder, right? What is actually happening inside her body to cause this? It's not some kind of infection, and it's not a sign of some other illness. The answer, believe it or not, lies within her own immune system. Yeah, it all comes down to what you could call a case of mistaken identity. It's almost like a bit of friendly fire happening right beneath the surface of the skin. So what is it really? At its heart, alopecia areata is an autoimmune disease. This means your immune system, the very thing designed to protect you from germs, gets confused. It starts to attack your own healthy hair follicles. But here's the really important part. It's non-scarring. The follicles are under attack, but they're not destroyed. And that means the potential for hair to grow back is always there. Let's stick with that friendly fire idea. Imagine your immune system's T cells are like highly trained soldiers. Their mission is to hunt down and destroy invaders. Well, in alopecia areata, these soldiers get their signals crossed and start targeting your hair follicles as if they were the enemy. This attack causes inflammation, and that inflammation is what makes the hair fall out. And this is not some super rare condition. Around the world, about 2% of all people will experience it at some point. That's like 1 in every 50 people. So if this is part of your story, you are far from alone. And the thing is, this condition really doesn't discriminate. It can show up in anyone. Kids, adults, men, women, people of every single ethnicity. It's just a powerful reminder that this is a human condition, plain and simple. Okay, so how does a doctor know for sure that what they're seeing is alopecia areata and not something else? Let's get into how they decode the clues. Well, the good news is, most of the time, diagnosing it is pretty straightforward. You usually don't need a bunch of blood tests or complicated procedures. A doctor can often tell what it is just by taking a really close look at the scalp and the hair during a physical exam. See, doctors are on the lookout for a couple of classic signs. The first is something called exclamation mark hairs. They're these weird little broken hairs that are actually thinner at the bottom near the scalp, just like an exclamation point. The second clue is a positive pull test. If a doctor gives a gentle tug on the hair right at the edge of a patch and a bunch of strands come out easily, that's a sign the condition is active right there. Of course, a big part of the job is ruling other things out. For example, unlike a fungal infection like tinea capitis, the skin in alopecia areata patches is smooth, not itchy and scaly. And it's different from something like trichotillomania or telogen effluvium because the hair loss happens in those very distinct patches, not from pulling or just general thinning all over. All right, so once you have the diagnosis, the next question is always the big one. What can be done about it? This is where we get into the management playbook. First off, it's really important to set the right expectations. As of now, there's no permanent cure for alopecia areata. The goal of treatment isn't to make it go away forever, but to help stimulate hair growth and manage the condition as it goes through its natural ups and downs. Now, the strategy really depends on how much hair loss there is. If it's what doctors call limited, so affecting less than half of the scalp, the focus is usually on localized first-line treatments. But if the hair loss is more extensive, that's when a specialist usually gets involved to talk about more advanced options. So for those with just a few patches, these are the typical go-tos. Corticosteroids, either as a cream you put on the skin or as tiny little injections right into the patches, are used to calm that local immune response. And topical minoxidil can also be used to give the hair follicles a little nudge to start growing again. And this part is so important because alopecia areata doesn't make a person physically sick. Choosing not to do any medical treatment at all is a completely valid and respected option. It is always a personal choice. Managing this condition goes way beyond just medical treatments. Support is absolutely key. The emotional and psychological weight of hair loss can be really heavy. So things like cosmetic options, finding a support group, or talking to a counselor, these are just as crucial as any cream or injection. So what does the future look like for someone with this diagnosis? Let's talk about the outlook and what you might expect on the journey ahead.
If there is one word that perfectly captures this condition, it's unpredictable. It's just the honest truth. For some people, the hair grows back and the problem never returns. For others, it can become a cycle of hair loss and regrowth that lasts for years. There's just no way to know for sure which path it's going to take for any one person.
But, and this is a huge but, there is a ton of reason for hope. For people who have limited, patchy hair loss, up to 90% of them see their hair grow back all on its own within 2 years. Sometimes this happens without any treatment at all. It's an incredible testament to the body's ability to heal itself. That said, there are a few things that can sometimes point to a more persistent or stubborn case. Things like the condition starting at a really young age, having very extensive hair loss, or even noticing changes in your fingernails, like little pits or ridges. And all of this brings us back to what might be the most important question. Medical treatments are one piece of the puzzle, sure, but how do we manage the journey as a whole? The emotional side, the practical day-to-day, that is just as vital. And that is why we want to end by pointing you to a fantastic resource. The National Alopecia Areata Foundation is an incredible place for solid information, for finding community and support, and they also fund critical research. If you or someone you know is navigating this, it's a great place to turn. Thanks for listening.